It's going to take a while to go from 32 in the House of Delegates to a majority, but it only takes a couple in the Senate. So it is the responsibility to serve this district by helping change the Senate. It's possible, it's not certain for this year. So I also think we need to come up with strategies for what we can do in the interim. Things like, how do we help, for example, EMTs who mostly sit and wait for the phone to ring actually do, for example, wellness checks for folks who've recently been in the hospital to reduce rehospitalization and hold costs down there and serve those families. We also need to address issues of women's health because the Medicaid expansion problem is skewed towards covering the needs of women in this state. When women don't have adequate care, they have children who also need additional care. So we actually need to address that piece. We do need to find Republicans we can work with, but we also need to talk to Republicans who are afraid of being primaried by talking to their constituents. If I am elected to be your nominee, I would actually go down to hospitals that are at risk of closing in southwestern Virginia and talk to patients about what happens to them if that hospital closes. Because until we create enough shame and pressure on the other side, the fear of being primaried is very, very real. In a 2-year election cycle, there's really not much of a break, so next year's the break, but it's not much of one. We need to actually apply the pressure from the other side to help those Republicans who would like to change their mind have the ability to do so. Thanks.